I see one of the doctors coming in.
Cassandra, I want to introduce you to Neha, or Dr. Sharma. She's one of our residents.
Hello.
Okay. You can introduce. Hi, Dr. Sharma.
Hello. Thank you for sending the link.
Oh, not a problem, not a problem. I know we had set it out a few weeks prior, and I meant to send it out to you all earlier today, but I had a procedure done today.
Oh.
And so my mind was not on that.
No
So,
worries.
but
No.
thank you for coming in. I hope we get more people onto the class. Okay, there we go, someone else. Okay, so in the meantime, I'm playing elevator music. So it has words in it, so it's not just all music. So called Mind Blowing Decisions by Heat Wave. And we can get started at 6:05. Station break. Sorry. There we go. Done.
Sounds good.
All right, good evening, ladies and gentlemen, now and afar. My name is Cassandra Taylor, and I am the founder and CEO of Top Flight Defense Incorporated, for all women, but created by a woman veteran. In this evening, we will be hosting a class called ADHD, taking a closer look at ADHD. Now, presenters this evening will be one student, one physician from Rush University Medical Center. First up will be Carrie Kane as our student, and then we'll have Dr. Neha Sharma. So ladies, take it away.
Great, thank you so much for the introduction and for inviting us. I have a PowerPoint which I can share. Is that okay if I share my screen? Let me see if I can do it. I think I can't just yet. Oh, there we go. Okay. I think you guys can see the PowerPoint now. Is that accurate? Yeah, good. Lovely. Okay. Right. So, hi everyone. I'm Carrie. I'm a third-year medical student, and today I'm here to chat with you guys about ADHD. I made this presentation with the support from two of our Rush psychiatric residents, one of whom is here, Dr. Sharma. And so here we go. I have a section at the end for questions, but if you have questions, feel free to shout them out or pop them in the chat and we can address them on the way. This doesn't have to be formal or anything. Yeah. Oh, didn't like that. Hang on. Okay. So today we're going to chat about a little bit basics about what ADHD is, and then some challenges to recognizing or diagnosing ADHD, and then sort of the process of what diagnosis looks like, and then treatment options. So that's just a general overview. Sorry, it does not like me using arrows. Nope. Okay. So to start, the official definition of ADHD, this is the beginning part of it from what psychiatrists call the DSM-5, which is this giant book, which basically has all of the like definitions for different psychiatric disorders. And the definition in there is that for ADHD is a persistent pattern of inattention and or hyperactivity / impulsivity that interferes with functioning or development. I feel like that's a little bit hard to understand. So for myself, I find it easier to break it down into two parts. And so basically with ADHD, you have the one part, and that's the inattention side. And so that's like having a hard time paying attention to what's going on or to details, making some careless mistakes, maybe not listening, not like having trouble finishing tasks because you get distracted in the middle, difficulty organizing complicated tasks or schedules, losing things. So that's sort of the inattention side. And then you have the hyperactivity or impulsivity side. And that is more representative of like the difficulty sitting still. Sometimes you hear about if it's a child, like the child is unable to sit still in the classroom, fidgeting, squirming, always on the go. Or also it can be like, it's really hard sometimes for people or children with ADHD to wait their turn. So a lot of like blurting out of answers in class or interrupting, things like that. So this to me made more sense. So it's like you have the two different parts. And the challenge is that not everyone presents with the same amount of both parts. So ADHD can look very different in different people. So other notes on the diagnosis. So symptoms have to start as a child, and then they can either continue or sometimes they can go away. We'll talk a little bit more about that later. But they must start when you're a child before 12, and they have to be present in at least 2 different locations, and they have to interfere with the child's life or the adult's life in some way. So that would be, they have a hard time making friends or a hard time in school, hard time in their job. So there has to be some form of interference. Oops, sorry, I keep forgetting I can't use the arrows. I just wanted to touch a little bit about like the cause of ADHD, which is still being studied and looked into. So we don't have a direct cause, as it were. There are sort of two halves to that. One is genetics. So it can be at least partially inherited. It's far more likely that you will have a risk of developing ADHD if you are closely related, like a sibling or the child of somebody who has ADHD. And the other side would be like environmental exposures or factors. So that could be prenatal exposure to alcohol or smoke can sometimes predispose a child to developing ADHD, or like malnutrition. But really what's important to note is that it's actually the combination of those, of like the genetic factors and the environmental factors. And that's sort of what we're still trying to understand with regards to ADHD. Sorry. And then this is a little bit about sort of what happens in the brain for someone who has ADHD. And that this is something that we're sort of continuing to study as, scientists have more and more ability to study the brain. But one thing that they've noticed is that the overall size of the brain of somebody who has ADHD may sometimes be a little bit smaller just across the board, and also may grow slightly slower. And what's sort of interesting is that the parts of the brain that help control attention, that's the part that's like right up here in your head, that can be one of the things that grows slower in a child with ADHD. So that would, potentially explain why it's hard for somebody with ADHD to, pay attention and maintain the same level of concentration. And so that's one sort of theory behind what might be going on inside. And then another theory is that it has something to do with white matter. So this picture on the screen, it's a picture of just a healthy brain, but I was using it as an example because our brains have this white matter in the middle here, and then we have the gray matter on the edges. And the gray matter on the edges, that's where the cells, your neurons, which are your cells in your brains, do a lot of the like thought processing. That's where their bodies are, but they talk to each other by sending these long tunnels or like chutes out from one cell to the next. And that's the white matter that you see in the middle. And sometimes people with ADHD have less white matter than their peers. And so there's some thought that maybe that decrease in white matter may be part of what makes it a little more complicated for them, or difficult for them to, focus or stay seated and focused on a task. So that's a little bit about what we think might be going on inside when someone has ADHD, but that's something that we're definitely still looking into. So next I want to chat a little bit about challenges to diagnosis, but how are we doing so far? Any questions? No? All right, we can just keep going. Perfect. So I mentioned that it doesn't look the same in everyone. It presents very differently in different people. So this is a comic by somebody on Twitter who goes by Auntie Be Present. And she has ADHD and uses her artwork to sort of reflect her experience. And as the comic says, it says, ADHD is different for every person. You may guess that the kid on the right may only have it, but truth is they both do. And the kid on the right looks maybe like he's far more active and visibly active and has that hyperactivity, whereas the person on the left maybe not so obvious to an external person like a teacher or a parent that they're struggling. And we see some gender differences. So we see that ADHD is diagnosed 2 to 9 times more in boys than in girls. But when we look at adults, it's actually only roughly 2 times more likely to be diagnosed in men than in women. And we also know that girls/women tend to be diagnosed later than boys and men. So clearly that's a huge disparity in when that diagnosis happens. And there's an answer as to why. And this is sort of my depiction of why that happens. The girls well, I guess I'll start with the boys. Typically, this is a generalization, but typically we see boys presenting with more of those hyperactive symptoms. It's more disruptive in the classroom, and there's more like interrupting or jumping out of the seat. Sometimes it can manifest as sort of overt, just like so much energy that there can be some aggression. The symptoms are typically seen as more severe or more easy to see from the outside. Whereas girls tend to present more with that inattention. So they don't have the jumping or the bouncing or the fidgeting.
Hold on, Carrie. I
Yeah.
need everyone to please mute your phones or your devices because we're getting feedback.
Great. Thank you, Ms. Taylor. So girls tend to present more with that inattention. And so it's not quite as obvious to a parent or a teacher that, you know, they maybe have ADHD. Sometimes that can present as more like daydreaming is what it looks like, or an inability to follow directions. There's a lot of internalizing of behaviors, which can lead to some anxiety and depression, which again is something that happens much more inside and isn't as obvious to an external person like a teacher. And then also girls can develop sort of these perfectionistic behaviors that help them sort of cope with maybe their trouble paying attention or trouble being organized. That can mask or cover up some of what they're experiencing. And so the end result is that girls tend to be less likely to be referred for diagnosis than boys, which means they get diagnosed later and they don't get the treatment that they need. This is another cartoonist who I read actually a lot of her stuff when preparing for this because she wasn't diagnosed until she was 28 years old. And she says that she felt very like an outsider. She was watching her classmates able to do these tasks like their homework and stuff that she wasn't able to participate in and do. And she felt like an outsider, or her word was an alien. So she started this account, ADHD Alien, to use her artwork to sort of show what it feels like for her some of the time. So examples would be like she's fidgeting or doodling because it helps her listen. People think she's playing around and not listening. She feels overwhelmed by unclear instructions, doesn't know how to start a task. And then other people maybe see her as like mocking or playing dumb. More examples would be she feels that she's unable to control what she concentrates on, and other people think she's just not trying to concentrate. She doesn't care about whatever the task is. And similarly, like she is involuntarily daydreaming, and other people might be seeing that she doesn't want to try. So clearly this would have repercussions in the classroom or at home or in the community if a child or a person is feeling, having a hard time concentrating, and other people are seeing it as something else and putting stigma on that. And because girls and women are typically diagnosed later, they have more of these internalizing factors, it's much more common for girls and women with ADHD to have lower self-esteem, more difficulty maintaining friends, and ultimately developing anxiety and/or depression than their male counterparts with ADHD, sort of because all of this is in there together. So that's just something that to note. And sort of further to talk about like difficulties of getting a diagnosis. So on the one side, we talked about how like it looks different in different people, and sometimes it's more obvious than others. Another thing that makes diagnosis kind of difficult is that ADHD can present some certain symptoms of it can look a lot like these other psychiatric disorders that could be going on either separately or at the same time, and you could have both. So for depression, difficulty concentrating, like low motivation to start a task, increased eating, those are symptoms that can be seen in depression or ADHD. Similarly, anxiety can have, that fidgeting and inability to sit still, sort of that anxious interrupting, or always being on the go. Sorry, I can't see that because the thing is over it. Always on the go or unable to relax. That's another thing that could be anxiety or ADHD. Similarly, PTSD has that anxiety component, that heightened awareness, and also during flashbacks to an external person, it could look like inattention or distraction. Obviously, we know it's not that, but it can present sort of similarly, or could be easily confused. And then traumatic brain injury would be another example where difficulty concentrating, increased anxiety, interrupting others, it can look very similar. So next. Moving into adulthood. So studies indicate that ADHD is in about 5% of children, and maybe 2.5% in adults. So if diagnosed in childhood, it persists into adolescence in 60 to 80% of cases, and into adulthood for 60%. That means 40% of children ultimately stop having ADHD, but the others still have it. The next slide actually shows more about how symptoms might change in adulthood. But so here, these are some symptoms that you would see more in adulthood, because you don't typically have the same like bouncing out of the chair, unable to sit still, that you might see in like a young person with ADHD. Instead, like that hyperactivity could present with restlessness, fidgeting, talking a lot, constant activity, wanting to do like really active jobs. Similarly, that impulsivity, which in the past might be like cutting in front of line or interrupting, could also now present with like impulsive decisions, like ending a relationship or quitting a job, overreacting to a frustrating situation, or interestingly, more driving violations. And then the inattention, that's the one that I feel like maybe presents the most similarly, where you still have that procrastination, difficulty with time management and decision-making and organization. Those things can still persist. But again, over time, as we grow, many of us are learning these skills. And so somebody with ADHD may be able to sort of develop those coping mechanisms, for some of these things. So some things may be present, other things may not be. It may not be completely clear. So on to diagnosis. So how do we actually make the diagnosis? So going to a doctor. ADHD is something that a lot of people are aware of, for sure, but it can be hard to navigate sort of finding support and finding help. And one way to do that is following your gut, and talking to your provider or somebody who you trust. As I mentioned at the beginning, the symptoms have to be persistent and impairing, meaning it's not like it happens for a week and then it gets better. So it's lasting for a long time. I think it's 6 months. And obviously have to have started as a child, and it has to be impairing in that it has to be causing a problem that then is disrupting the person's life in some way. And then it has to be seen in two different settings. So as a child, when talking about a child, often the clinician talks to the parent and then the teacher to see like that home life and school life balance, with the understanding that certain symptoms may be more obvious in some settings than in other settings. So for example, a child who is super hyperactive in the classroom, that might be what the parent or the teacher talk about, because that's what they're encountering at home and at school. But if you talk to the soccer coach, maybe they're like, well, yeah, they don't notice the hyperactivity. They're like, yeah, but they can't really follow a drill because they can't pay attention, right, to the sequence that we need to do or whatever. So it can present differently in different settings. And ultimately, the diagnosis involves a lot of testing. First, testing for like medical things that could be causing some of these symptoms. I talked earlier about some of the psychiatric diagnoses that can present similarly, like the depression, anxiety, PTSD, and traumatic brain injury. But also certain seizures. There's a type of seizure that children get very relatively commonly, where they stare into space. And so, maybe that's what the daydreaming looks like. Thyroid testing, having too much thyroid hormone can cause a jitteriness and sometimes some anxiety. And so checking like the thyroid levels, checking a person's like visual and auditory ability, because if the child can't listen, if they can't hear what's going on in the classroom, then of course they're going to have a hard time paying attention and focusing because they don't, or they can't follow the directions if they can't hear them, So checking some medical things, as well as then the biggie for ADHD diagnosis is the neuropsych testing. That's when the person, child or adult, would be referred to a psychologist, and they do a whole series of tests. These are some examples of some of the tests that we have or that we would use. They're different for children and adults because it can present a little bit differently. And for adults, there is that self-reporting aspect because we want to know whether the symptoms were present in childhood. Also, I think sometimes we would talk to the parent of the adult if available to hear about what their experience of the child, or the now adult, but was when they were a child. And then this is another form of testing that could potentially be used. It's basically a computerized task where the person is asked to do a specific task with following a sequence of numbers or letters, like press every time that you see an E or something. And if they're not able to do it, then that, it's not usually used to diagnose ADHD, but it might be a good marker for when somebody needs treatment or not. So somebody asked a great question in the chat, which as a student, I don't know a ton about. How does insurance play a role in being able to receive adequate evaluation? I don't know if Mia, if you know more about insurance, or if we want to wait to the end to ask about that, but we can definitely chat about that at some point.
Yeah, I'm honestly, we're not the best people to ask about that either. Typically it's the social workers and like the admin staff in the clinics that help coordinate all of that. So I would guess insurance, just to make sure that there's coverage to see the psychiatrist that you're in network with, or if that's available. And then would be similar to the neuropsych testing as well. But I don't have details on it, unfortunately.
For the person that asked the question, based off of what I've seen at Rush, it's all in the coding and the necessity of the condition in which the provider is putting that in. So yeah, billing is really all about the codes, what code they put in, and the significance of the condition.
Sorry, it took me a moment to unmute. Thank you guys for helping out with that answer. Next, so chatting about treatment options. So there are several treatment options, but the first line treatment, or like what we go to first, is always medication, because it has been proven to be so helpful for so many people. And the first one that we typically try is, assuming it's safe, is a stimulant. And so this is basically a medication. There are two that are known more, colloquially. One of them is methylphenidate, which is generically known as Ritalin. And then the other one is dextroamphetamine and amphetamine salt combinations, also known as Adderall. And so Ritalin and Adderall are both medications that help increase a chemical in your brain called dopamine. And it's been shown to work really well for people with ADHD and helping them focus and helping them sort of be a little less hyperactive. And it's usually pretty well tolerated. Sometimes there are some side effects. Most commonly, we see a decreased appetite, which can lead to weight loss, also some trouble with insomnia or irritability, and sometimes headache. Also, one thing that can happen is hypertension, which means that sometimes patients need to have a cardiac workup done before they get prescribed either of these medications to make sure that there's no risk for their heart. And then a final one would be psychosis. That would be a side effect. It's more rare, but stimulants are a controlled substance because there's potential for misuse there. And the most common thing that we would see in the ER is psychosis due to use of one of these medications. After the stimulants, we have some non-stimulant medications. The first one that we would sometimes turn to is atomoxetine, also known as, I don't know how to pronounce this one, as Strattera, I think. It's not as ideal. It's dosed 2 times a day instead of once, which the other medications are dosed once, and can cause some increased suicidal thoughts in children and teens, which is another reason we don't use it and first. We also have some other medications that are in a class that we call alpha agonists. That just is a reference to what receptor it binds to in your brain. But clonidine and guanfacine are those two. And they have some more side effects that, and they're not always as effective as the stimulants are. And the side effects would include low blood pressure, dizziness, sleepiness, and sometimes people, if you're on clonidine and then you stop taking it, your blood pressure can go really high. So that would be a concern for that one. And then finally, one that sometimes we use is bupropion or Wellbutrin. And that is actually technically an antidepressant, but it acts to increase the same chemical in your brain, dopamine, as the stimulant does, as well as another one, norepinephrine. And it works a little differently than some of the other antidepressants that you guys may have heard of, like the SSRIs. So this one works a little differently. But Wellbutrin can be really great in treating people who have ADHD as well as depression, and can also help with smoking cessation. So that's one that often will give to people who have a more complicated history. And the main side effects there is just being aware of potential seizures. And then, of course, there are non-medication things that we can do. So psychoeducation and academic organizational skills support. So helping teach someone how to be more organized or keep track of things. Also, cognitive behavioral therapy can be really helpful, and support groups can be really helpful. Just because when you're going through something really hard, it can be helpful to know that there are other people that have gone through that and are going through that same thing. This is, again, ADHD Alien. She has a pretty long series. This is the end of that comic, but explaining how she felt like an alien. And then she goes to a support group for the first time. And she says that seeing people with the exact same faults is how at 28, for the first time in my life, I felt like a human being, because she suddenly felt validated in herself and in her experience from knowing other people had similar concerns or similar problems to her. So I included a little bit for more information. So there's a website, Children and Adults with Attention Deficit and Hyperactivity Disorder. They shorten it to CHAD, which I'm going to be honest, I don't think that exact CHAD doesn't really make sense to me with those letters, but and they have some really great information on there that I was looking at for folks who want to learn more. And then also, I really enjoy learning from other people's stories, right? Instead of just myself, who maybe hasn't experienced some of these things. So on Twitter, there are 3 people that I read. The 2 are the cartoonists that I showed you, ADHD Alien and Anti-B Present. And then there's another, Renee Brooks, also known as Black Girl Lost Keys, who talk about sort of their experiences with ADHD and how that affects them. That's been really cool. So next, I have questions. I see there's some stuff in the chat. Sorry, I couldn't keep the chat. Turns out I can't keep the chat open, or I can't see my own screen.
If you want, I can read the questions that are in the chat.
Yeah, or I can just stop sharing my screen for now if that's...
Okay, there you go.
Yeah, I can do that. Okay.
All right, so what I'm going to do, because I think we're going to get personal here, I'm going to stop the recording so that it won't go. All right, hold on, please.